Doctors of Reddit, what's something someone came to the hospital for that they thought wasn't a big deal, but turned out to be much worse? I'm not a doctor, but this happened to me. I have suffered from chronic earaches and ear pain since I was a few months old. When I was in 8th grade I was sitting in class when my ear popped, except this wasn't the normal pop that releases the pain. It felt like someone had shoved a red hot metal rod in my ear. Under closer inspection by my pediatrician, who has dealt with my ears my whole life, and is one of the few doctors that believed that I was in pain, and he said it was the worst eardrum rupture he had seen. But since I have had this happen a lot, I just took some medicine and went home. Over the next few months my earaches got severely worse, so I went to see an ENT who basically told my family nobody's ears hurt this much, or are this sensitive. He is faking to get out of school. After my 5th visit in a month to that ENT, he suggests a MRI. At least I think that's the big circle thing with the magnets. Ends up that bad rupture had caused the skin in my ear to grab onto the bones in my ear and form a tumor called a cholesteatoma. This tumor was literally eating away at my ear, the bones in it, the cartilage, and was eating into my skull. I went to see a specialist for this who ended up removing the tumor after a few months and having to completely reconstruct my eardrum and the bones, and a lot of the damage could have been stopped if the original ENT had believed me about my chronic pain. The result in all this is that I have an artificial eardrum made from the muscle in my jaw. They kinda botched that part, one think, because I can't even chew food really with the left side of my jaw after it, and the bones were replaced by the cartilage from the outside portion of my ear. The surgery resulted in bad nerve damage that makes every day a struggle, and I can't hear out of my left ear. TLDR, I had my eardrum burst, which resulted in a tumor that wasn't noticed by a doctor because he thought I was faking. Had the tumor removed, but I lost my hearing and have to deal with pain from the nerve damage every day. Not a doctor, but I was a patient in a similar situation. I had a sudden pain in my abdomen that doubled me over. I was sure it was just probably really bad gas pain, and if I just tuck a really good sheet I would feel better. But at the time, so was insistent. We went to the ear point, get to the ear, and they do an ultrasound. Instead of the giant gas bubble I expected, they discovered a cyst on my ovary the size of a softball. The doc advises that they are very common, and the usual course of treatment is to give me birth control pills and send me on my way, but since this one is so large he wanted to consult with a gyno. This being a podunk coastal town, the gyno on call was over a half hour away, so instead of bring her in they sent her my results. The gyno agreed that most likely everything is fine, but the tech who did the ultrasound had left out a picture of the blood flow going into the ovary. The gyno wanted that pic to be absolutely certain things were fine, even though the tech stated they had looked at it, just forgot to snap the pic, and everything looked fine. Still had to go for the second ultrasound. The second ultrasound showed the blood flow was fine, but now my abdomen is filling with an unknown liquid that had not been there before. At this point the gyno decided to drive in and examine me herself. I'm told I don't have to wait in the room and can go out to the waiting room if I would prefer, since it was going to be a while for her to show up. A few minutes later I'm out in the waiting room and I want some water. My so had to be home with the kids and the neighbor is with me and offers to get me the water. I drink said water and stand up to walk about 10 feet to throw away the paper cup. Halfway to the garbage can I suddenly feel very nauseous, shaky, and weak. I barely make it back to my seat before I vomit pretty violently. The nurse tells me to just stay seated and not to drink anything else until the gyno arrives. I feel fine the rest of the time I'm waiting for her. When she finally arrives we talk and she explains she wants to do this procedure where they stick a very long needle through my cervix and draw a sample of the liquid. She's pretty sure it's a leak in the cyst and that the body will just absorb it and I'll be fine, but she wants to be 100%. So there I am, my legs in the stirrups, while the doc tries for her sample. And tries 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 and oh my god, stop faking trying already. After piercing my cervix something like 20 times she finally gives up. All she can get is the blood from the now many holes in my cervix, and she states she can't torture me anymore and is giving up. I'm so relieved that is over, and I'm so damn ready to get out of this podunk hospital, and she seems ready to send me on my way as well. She tells me that she is 99% sure that the fluid is just a leak from the cyst and that I'll be fine, but that if I would prefer she could perform a laparoscopy and find out for sure, but that it's up to me. I ask her what the worst case scenario is here. She says well the worst case scenario is that it's not cyst fluid, but is blood, and that you're hemorrhaging, you don't get back to the hospital in time and you die. At this point I'm thinking there's no way I'm going to die from this, so I can probably go home, but I ask you said not get back to the hospital in time. I came to the hospital because of the sudden pain, but you guys have me on pain meds now, and I'm not feeling any pain, so how will I know to come back to the hospital? She says well you'll get really nauseous and weak and shaky. I respond I did that in the waiting room waiting for you to get here. The Gino takes one look at the nurse, who nods in agreement and her attitude immediately changed. She explained we are going to do the laparoscopy ASAP. She explains it's only going to be about 15 minutes total. They are just going to cut a little notch in my belly button, blow in some air, put in a camera, and take a look. I sign consent forms and I'm prepped for surgery. Up to this point I've not felt scared or worried about the situation. The information is coming in, I'm analyzing it and responding, but emotional I'm like a rock. But when I was laying on that operating table, just as they were putting the oxygen mask on my face to put me out, I glance at the clock and realize it's striking midnight. That's when it hits me. I'm on an operating table in a tiny hospital in a tiny town and midnight shit is serious. Just as I can feel I'm starting to freak out, I'm under. The first thing I become aware of is this strange whooshing sound and the sensation of something alternating squeezing my feet. I open my eyes and everything is bright and white. I feel nothing at this point other than the squeezing. Out of the corner of my eye I notice a large window and movement behind it. I turn my head towards the movement and the most excruciating pain I've ever experienced washed over me, radiating out from my stomach. I scream out in pain and clutch myself. A nurse comes rushing in, and at that moment, told me what had just happened. Apparently as soon as the Gino put the camera into my abdomen, the cyst and my ovary burst. I was gushing blood like a garden hose. That 15-minute exploratory surgery turned into a 2.5-hour emergency surgery to save my life. She gave me a shot of drugs and I went back to sleep. The next morning the Gino walked into my hospital room and the first thing she said to me was, if I had sent you home last night I would have killed you. It was a very sobering moment realizing just how close I had come to death and had no clue. The ovary was going to burst, whether I had that surgery or not, but to be on the table surrounded by doctors when it happened is probably the only reason I'm still alive today. That and the fact the ultrasound tech forgot to take a picture. TLDR, went to the but was convinced I had to take a sheet, but discovered large cyst. Ultrasound tech's mistake leads to life-saving information. Doctor almost kills me by sending me home, but in the end, I kept my shoes on. Not a drive either, but this happened to me. About 4 months after I had my son I started to notice the vision in one of my eyes was really off. Blurry, spotty, etc. I didn't really think about it much because my eye didn't hurt and wasn't itchy and I had a new baby to take care of. Anyway, it lasted for months and finally my mom and sister convinced me I had to go to the eye dry for it to see what was going on. I took baby with because I thought hey quick apt, maybe 20-30 minutes and I'll probably leave with some eye drops or something. Honestly one of the worst days of my life. They put me through test after test. I was there for hours. I ended up calling my mom to come get the baby. They weren't telling me anything. They scheduled an MRI for the next morning because by this time my 11 AM appointment had dragged out until 5:30 PM and the clinic was closed. We were the only people there. Still no answers. I'm freaking out. Go back the next day and get the MRI done. They send me to the neurologist this time. No eye drives today. When I walk in he has all the results from my tests the day before and the MRI I had just taken a while before. I was told I had multiple sclerosis. It was very scary. Edit. They edit too. For those that have asked, I'm doing pretty well. Still in the first stage of relapsing, remitting milliseconds. I've stayed hardcore on my therapy and my family is extremely supportive, which makes a huge difference. The first years were the hardest with a toddler and learning to adjust. Now he's 10 and more self-sufficient. We decided not to have more children, which was really hard, but overall the best decision for our family. This actually just happened to me a few days ago. I'm an internal medicine resident who's doing rotations in the ICU. If there is an emergency on the floor on admitted patients, the ICU team gets called to see them. So we got called to an emergency where some admitted 59-year-old patient got dizzy and almost passed out while on the commode, a portable toilet for patients. He was originally admitted the day before for high fevers and a high white blood cell count, which they attributed to some unknown infection. No real medical history, except high blood pressure and cholesterol. We assessed him, and he seemed a little tired, but he was awake. His vitals were okay, although heart rate was a tad high, like 105. Normal is 60-100. On examination, his belly was somewhat tender. We ordered a lactic acid, which is elevated if some organ isn't getting enough oxygen, and a cord scan of his abdomen. The labs were ordered stat, but since his vitals were fine and his exam was not too alarming, we didn't push for things to be done immediately. Since I had a small break while waiting for results, I watched the Seahawks with their crazy comeback against the Packers. While I had just opened up the cord scan to read it, I got a call from the radiology resident. The results showed that the patient had a ruptured abdominal aorta and right iliac artery. In other words, the major vessels in the abdomen had completely burst. Blood was pouring out at incredible rates, and the patient needed surgical reparation immediately. The death rates for this are about 90%. At this point, we ran to the patient, who was still awake but irritable, and his blood pressure was around 60 systolic. Normal is 120, which meant this guy was probably bleeding out like crazy. His sister saw the urgency in our faces and just broke down in tears, knowing something was wrong. The nurse led her out while we managed this patient. We gave him fluids to bring his pressure back up and called a vascular surgeon. The surgeon said this guy's already dead, but was on his way. Unluckily for this guy, this was a Sunday, and none of the OR team is in the hospital. So we had to keep him alive while we waited for the surgeon and his team. The blood pressure came up to like 110 systolic, but it did not mean much. His belly suddenly got crazy distended, probably from all the blood pooling in there, and his heart rate fell down to the 40s with street elevations seen on the monitor. Probably started to have a heart attack due to decreased oxygen. His pressures tanked, and we lost a pulse. It was time to start chest compressions and intubate the guy, put a tube in his trachea, and put him on a ventilator. We got a pulse back and his pressure surprisingly came back to an acceptable range. What happened was that the blood had filled his abdomen to its maximum capacity, so all that abdominal pressure was causing his belly to get distended and hold the blood in its vessel. Aka tamponade. The guy was hemodynamically stable for another hour or so while we waited for the team. When he finally made it to the operating room, the team was ready for quick action. The team has a few seconds to clamp off this guy's vessel while they try to repair it. However, as soon as they cut the patient's abdomen open, blood just poured out at a rapid rate. The pressure dropped so fast that the patient died within seconds on the table. TLDR 59-year-old guy came in for what he thought was a flu, ended up having a ruptured aorta, died on the OR table in seconds after incision. We had a guy who showed up to the ED with a bad cough. His wife kept saying that she had tuberculosis 20 years ago, and although she was treated at that time she was convinced he had it. His symptoms were far more consistent with pneumonia and he lacked classic TB symptoms. We got an x-ray, and sure enough it was TB. Now I have to do several blood tests over the next few months to ensure I don't have TB. Sometimes the patient is right. Another time I saw a lady in the ED with a chief complaint of headache. She basically provided no history and just kept repeating that her head hurt. I tried to get some background, past medical history, etc. but she wouldn't say anything other than my head hurts, give me something for the pain. On her chart she had tons of previous visits for vague complaints and requests for narcotics which all resulted in basically nothing. So I initially thought maybe she was drug seeking, but her behavior just seemed odd. We decided to scan her head and left to go see other patients. I came back a few minutes later and her husband was there now. I asked what happened, and he said she was just standing in the kitchen cooking when all of a sudden she dropped to her knees and then immediately complained of a horrible headache. While I was talking to him, she began vomiting all over herself. We rushed her to court and she ended up having a subarachnoid hemorrhage, bleed in her brain. She was taken straight to surgery and ended up being fine after spending about 6 weeks in the hospital. Little on the long side, and this is the short version, and I'm not a great writer, but here's how it goes. I've got a couple interesting details to my story. Walked, barely, into the hospital a couple months after my 19th birthday, and 3/4 the way through first sophomore semester of school for hip surgery, my 4th surgery in life. I'd always had bad joints and been in pain most of my life. Lucky I made it that far without surgery. For the surgery they gave me an epidural needle in the spine where the drugs are pumped straight into the spinal column. Do not pass go. Do not collect $200. Just enjoy the ride. So after the surgery the doctor tells me he was amazed I was able to walk at all with how much my muscles had atrophied and how bad the bone was. I should have been in a ton more pain beforehand, but the surgery went well. This was Friday evening. He said I should be up and walking by Sunday and discharged by Tuesday. Late Friday night the anesthesia fully wears off and I'm in more pain than ever before. Indescribable pain. I keep telling the nurses and they've upped my pain meds as much as possible. Again, these are being administered through the epidural. I'm maximum doubt. Even for a big guy like me, they can't push anymore. They just say I have a weak sensitivity to pain. I'm in too much pain to argue with. I'm howling it hurts so much, told to keep it down. Begging for their help, they can't do anything. Paging them, they don't come. Least that's what I think. What happened was I would page them, and by the time they got to me, I blacked out from the pain. This continues for 2 days. Eventually, somehow, my brain just burns out, and I can't feel anything thankfully. I tell most people, family, and friends that I don't remember that night, but I remember every damn second of it. Well, when I wasn't blacked out anyway point. So Monday morning comes around and not only am I not up and walking like doctor said Friday, but I can't feel anything below my waist. This gets their attention and I'm rushed for an MRI. They saw something bad cause I went straight to the OR from there. I'm told they saw what they thought was a hematoma in my spinal column. The doctor gets in there to fix it and finds a tumor. They remove everything they can, and I spend the next week in the hospital getting every nook and cranny of me scanned. This includes a 3-day no food allowed, so they can do my stomach and stuff. Day 2 of which was Thanksgiving. What happened was this. They had placed the epidural one vertebra below where a slow-growing tumor was located. Somehow doing this whole thing caused it to swell enough to compress my spinal cord, damaging it and blocking the meds they kept pumping into me from hitting my brain. So after the general stuff wore off I felt everything from the surgery, and that was no minor trauma my body was put through. The reason I was able to walk so little muscle is because it was already diminishing my sensitivity in my legs before surgery point anyway. One more quick surgery to get a central line put in and bone marrow test done, which I almost botched by pulling my tubes out mid-surgery, and a trip to ICU before going under the knife was done. This was the start of 13 weeks spent in the hospital bouncing between physical therapy and oncology. Chemo continued for 6 more months. My aunt, the greatest person I've ever known, took me in when my own mom wouldn't. She moved and upended her life for me, taking care of me when I couldn't do anything. I spent the next 4 years living with her until I got my shit together. Went back to school and graduated with BS in CS. Got a decent job that I like going to most days. Couple great friends, and finally getting my act together and losing weight. While I still can't walk yet, I'm making do. I haven't given up hope on that. Life sucks sometimes, but I'll be damned if I'm going to let the universe win without a fight. TLDR cancer, it's always cancer. But that's how I roll now, that in my chair. I made an account specifically to answer this question. Obligatory, not an MD. Have worked in the medical field for a while, work for a large research hospital. because I've seen so many patients come in for a routine check and leave with more ominous diagnoses. We hold an annual free otolaryngology, layman's terms, is nose throat cancer screening, and I always volunteer to stay and work the front office. Last year, we had a man come in for a screening, and he brought his wife along. They were a lovely couple, and were very nice, chatting about their kids, and about the fact that the wife pressured him to come in to get checked, even though he felt fine. ECT. The man looked like any blue-collar worker, middle-class American. Point generally, the cancer screening takes 10 minutes top, if the patient is negative. This man was in an exam room for an hour, minimum, and at that point I knew something was abnormal. They finally emerged, and the wife was sobbing, and the man was just ash white. One of our oncologists came out and instructed me in getting him appointments for radiation, chemo, and a host of other doctors. Come to find out, this man had been walking around with rapidly spreading laryngeal cancer, specifically squamous cell carcinoma, and had no idea. He had felt perfectly healthy aside from a sore throat here and there, absolutely no signs or symptoms that would indicate to anyone that something was amiss. There was a happy ending though. He went through chemo and radiation treatment and had to have a total laryngectomy. They removed his entire larynx, meaning he now has to breathe through a trach in his neck and use an electrolarynx to speak, but they removed all of the cancer and he only comes back for routine checks now. We also have parents who bring their children for a hearing test, thinking that the child just doesn't want to listen to them, and then are told that their child is severely hearing impaired and will need artificial assistance, hearing aids, cochlear implant, bone-anchored hearing aid, to hear for the rest of their life. Point. Now that I'm thinking about it, I have lots of stories that fall under this category. Pretty depressing. My son was 7 months old and had a fever that wouldn't go down. I tried Tylenol, cool bath, and it kept rising. He was my third baby, so I wasn't terribly concerned, but we were leaving the next day for a weekend at a remote cabin, and I thought I should get him checked out and get some antibiotics for him. I called the clinic just as it was about to close. They stayed open for me, and when I walked into the empty waiting room, he vomited all over me. The doctor looked in his throat and in his ears, then turned to me and said, "With your permission, I would like to do a spinal tap." They ushered me out of the room, then called me back in a few minutes. The doctor showed me a vial of fluid and told me that, because it was cloudy, that he had spinal meningitis. She asked me if I was okay, then told me, very calmly, to put the vial in my purse, take my baby, drive directly to the hospital, go into the emergency entrance, walk directly to the elevator, go up to pediatrics. People would be waiting for me. I did as I was told. When the elevator doors opened, there were about 5 people waiting for me. They took my baby from me and hurried away. The next time I saw him, he had tubes and sensors all over his body. It was a scary night, but he made it. I knew he was going to be alright the next morning, because while I was nursing him, someone came in the room, and when the door closed, he did that baby startle thing, hands in the air. With meningitis, the hearing is the first thing to go. 10 days in the hospital, but full recovery. The clinic receptionist that kept the clinic open for me later told me that she just had a funny feeling when I called. Not a doctor. My mom took my brother to the hospital for what she thought must be a horrible case of colic. He wouldn't drink, so she thought it best to get him looked at. The doctor noticed that one arm was bent just slightly between the elbow and shoulder. X-ray revealed it was shattered from shoulder down. Ouch. So doctor called CPS. CPS took the time to listen to my mother when he had been fussy the entire time he had been alive. Sent him and her to the nearest children's hospital, where it was determined the breaks had to have occurred at birth. They said there was no way the delivering doctor could have not known. The breaks looked like they would have occurred while my brother was still in the birth canal. Theory was that the doctor grabbed his arm and yanked hard to try and get him out faster, and some bone fragments got moved around when he realized what he did and tried to straighten my brother's arm to avoid anyone noticing. CPS notified the state, who started investigating the doctor. Doctor left the state within a week. Mom says she read in the news later on that the doctor was accused of several birthing injuries when he was caught. But at the time he had been the only doctor in the county who accepted state insurance. I guess that was a habit of his, only practice in towns where no other obs/gyns accept insurance from the state, so you can't get sued by your poor patients. Scumbag point. My brother is 25 now. At 5 he had plates and pins put in his arm to try and reconstruct the bone. By 7 they stopped physical therapy because state insurance wouldn't cover anymore. At 10, he fell from a rail on someone's porch and broke one of the bones in his neck and put a sizable dent in the back of his head. Doctor said he wouldn't have been injured at all if he had been able to use his other arm to brace himself for the fall. Today he can move his fingers and shoulder at will, but not his elbow. He has to lift it with his other hand. His shoulder will only extend his arm to being level with his neck and only to the side. He can't move it front to back. He can't feel his arm or hand at all. He can move the fingers, but when he accidentally chopped off part of his thumb he felt nothing. He works as a medtech for a company that provides services to the developmentally disabled. They are the only people who will make appropriate accommodations for him to work. Everyone else in town says the accommodations are unreasonable. He just needs to be able to pass meds with one hand. A rolling table is all he needs. He gets no disability benefits at all, and since the company knows no one else will hire him and keep him, others have hired him, only to order him to resign after seeing that he really can't use that arm. They only pay minimum wage, even though the going rate for a medtech in this city is $11/HR. He has looked into suing some employers for the treatment he has gotten, but lawyers from other towns refuse to come here for that sort of case, and lawyers here want $10K to even start paperwork. Pretty bad case of colic, right? I work for a medical scribe company and worked in a smaller emergency department for a few years. There is one case that will stick with me forever, and even though I'm late to the party, I'm going to tell it now, because it underlines the importance of routine health screenings you need to get as you age. The patient was a mid-60s-year-old female who presented with some generalized intermittent abdominal pain for several weeks, and one instance of stools that were lightly streaked with blood. She assumed she had some kind of gnarly stomach bug, as did we, considering her symptoms weren't particularly severe and her abdomen had no localized tenderness. My physician and I took a liking to this patient because she was really friendly and outgoing. Talked about how her and her husband liked to take trips to Las Vegas, laughed about the weather, and spent several minutes having some light-hearted small talk with her. She admitted that she wasn't much of a doctor person and hadn't had a single colonoscopy since she turned 40 and had also neglected her yearly gynecological exams for several decades. This worried my doctor, and, given the generalized characteristics of her symptoms coupled with her less than stellar health maintenance, decided to get an abdominal cord scan to rule out anything major. The results were horrendous. This woman's abdomen was riddled with tumors near her liver, pancreas, and colon, the largest of which was localized next to her uterus. Anyone who has ever seen a radiologist report or two can attest that radiology reads are often intentionally vague, referring to things as nodules or masses and typically recommending clinical correlation and further testing before they could say anything definitive. Not this report. The imaging was so obvious that the rad indicated this patient was in an advanced stages of metastasis, and even so far as to indicate the growth seemed to originate from her uterus and cervix. Jesus, said my doctor. If she had gone to the gym or gotten a colonoscopy they might have caught this earlier. We are about to go back in there and hand this woman a death sentence, and we did. The woman took it about as hard as you would expect, and there were many hugs and well wishes as we discharged her to home. There wasn't anything acutely serious enough going on to admit her, though we explained to her she needed to call an oncologist the next day to schedule a visit, so she could discuss treatment options. I cried for this patient on my drive home that night. I can't even imagine coming in so cheerful and upbeat, and having your entire worldview changed so drastically with one piece of news. She will stick with me for the rest of my career in medicine, and is always on my mind when I talk to my parents about the importance of routine medical screening. We can never say for certain whether yearly exams and 10-year colonoscopies would have improved this woman's outcomes, but I would rather her have had a fighting chance than being blindsided so late in the game. I hope she can find comfort and peace in the remainder of her life. Not a doctor, but around 5 years ago, I was having severe pelvic and kidney pain. I'd never had a kidney stone or infection before, but I was sure that I had one because I couldn't really think of anything else that would cause pain like that. After seeing my GP, the pain kept getting worse and worse. Finally, the pain got to be too much to bear, and I called my doctor and let them know what was happening. They thought I might be passing a kidney stone, and they told me to go to the ER point. My husband drove me to the ER and the pain was getting worse and worse. They gave me pain medication and gave me a cord scan. After the ER doc looked at my chart, he started acting really concerned and all the nurses' attitudes changed towards me. Everyone was suddenly really nice to me, but they wouldn't tell me what was wrong, which was horrifying. They scheduled me for a transvaginal ultrasound. Basically they stick a wand up your vagina and look at your reproductive system. The ultrasound technician kept making this really weird and concerned face, but she wouldn't tell me what was wrong. After 8 hours in the ER, the doctor finally came in and told me that I had 2 blocked fallopian tubes and tons of cysts covering my ovaries, one of which had exploded and coated my entire pelvic floor with endometrial fluid. I had stage 4 endometriosis. Within a year and a half I would have 3 surgeries, have both of my ovaries and fallopian tubes removed, and find out I was entirely infertile. TLDR, I thought I had a kidney stone, but I had a really painful disease that was essentially eating my entire reproductive system. Holy shit, I just realized this thread applies to me too. Very late to the party, and I posted this below another comment, but I'll do it in the main thread for op. I'm not a doctor. I was the patient. 3-year-old me had been drinking fluids almost exclusively for a few days. My mother's mother senses weren't tingling so much as they were screaming something was wrong. She called the local pediatrician's office, who said that it's just the time of year, it was very dry, and it's normal for little kids to be very thirsty. After day 2, my stomach was swollen like a 50-year beer drinking rednecks, and I was still demanding more drinks. I had gone through a whole bottle of apple juice and carton of milk, and was proceeding to down water like no other. My mom called again, and this time they were a little annoyed, as they had already given a diagnosis. My mother insisted something was wrong, and asked to set up an appointment. They informed her that the doctor was on vacation, and would be back in 2 weeks, and to bring me in then for a checkup. This didn't fly with my mother, and against their wishes she brought me in anyways, to a very pissed group receptionists and nurses, who scolded and scoffed at my mother for being ignorant. They took me into the patient area from the waiting room, and no more than a minute had passed before every single one of them filed into the waiting room, approached my mother with me in tow, and said, "Ma'am, we are so very sorry. We should have listened to you, but you need to take your son to the ER right now. He has diabetes." My blood sugar was off the charts, and that, folks, is as far back as my memory goes. I have lived my whole conscious life with diabetes since. My memory started with drinking juice on a couch and spending the next 2 weeks in the ICU with kids who had it way worse than me. I've maintained that I'm very lucky to only have diabetes, and that it could always be so much worse. Just to relieve some of the gloom, here's a small issue. Worse, better story. My family has a strong history of breast cancer, so even though I'm very young, when I found an olive-sized hard lump in my breast, I got it checked out by a specialist. I figured it was probably just a cyst or something. Got a needle biopsy that confirmed it was harmless. A year later, at a regular checkup, same doc notices the lump they'd biopsied has grown very quickly. The growth pattern, size, and shape of the lump matched a highly aggressive form of cancer that sometimes false negatives as a type of harmless growth. My last biopsy had identified it as. This type of cancer is aggressive and does not respond to chemo or radiation. Terrifying to say the least. The only way to find out for sure is to have the whole lump surgically removed and retested. So I went in for a second procedure and waited for the results. It came back harmless. What the original test indicated it was. I was fine after all. I'm only putting this here to reassure people that not every scare ends in tragedy, and a doctor's visit that ends in good news is not a wasted visit. I'll have to be vigilant about my breast health my whole life because of my genetics. I'm just happy when everything turns out okay. So if you ever go for your annual physical and then groan about how it's a waste of time because nothing's ever wrong with you, just focus on being happy that you're in good health and remember that vigilance is part of how you stay that way. I'll be way late to this and you may not get a chance to read it, but you asked, so I'll answer. I've had this happen a whole lot. Think of any serious concern we as medical professionals may have to be concerned about, and I've probably seen someone come into my clinic complaining about something they think is minor, but ends up being a huge deal. I'll share a couple notable examples. Lady walks in, sits in the waiting room a while, comes back complaining of her back and ribs hurting. She was having a full-blown heart attack and coded in my exam room. She lived, though. Guy comes in for nausea and indigestion. He had a gastrointestinal bleed that ruptured while he was in the waiting room. He died. Guy that hadn't had insurance in a while comes in with the flu. Never seen in our office and had a first visit exam scheduled the next week. I agreed to squeeze him in if he agreed to wait until I had a chance to. He probably waited more than 2.5 hours, and it was a little after 5 p.m. when we usually don't even schedule patients after 4:30. Since we'd never seen him, I did a really brief general physical to make sure I didn't need to be worried about anything more serious. Saw a spot on his foot that concerned me. It was melanoma that had moderately progressed. It's a very aggressive cancer. We got it taken care of and he lived. My mom was having problems keeping anything down, not even liquid. Anytime she would eat or drink, she would puke immediately after. My mom had the lap band. Doctors just said she was not wanting to eat / wanting attention. My mom is a workaholic. The hospital is the biggest inconvenience for her, and we had to force her to go. She had been in the hospital 3 days at this point. She was never left alone. My grandma took day shift, and I did from mid-afternoon to 5/6 a.m. and my dad would be there before and after work. The day that she was supposed to go in for exploratory surgery at 3 p.m. had come. It was a typical overnight with my mom, which sleeping in the hospital chair all night freezing while being pregnant sucks ass. The nurse had came in and said your blood pressure is through the roof, and my mom was saying her pain was elevating a lot. 5 a.m. I called my grandma to let her know what the nurse had said. G said she was almost to the hospital. 10 minutes later my grandma was in the room. Mom was tossing in pain a bit. Mom told me to head home for a few hours of sleep before I had work, then come back. As I was picking up my stuff, my mom screamed at the top of her lungs in pain and could not stop moving from being in so much pain. 5 nurses ran in, tried to hold her down. They were prepping her for emergency surgery by trying to put a second fourth in, since her current one was at 4 days. They blew 5 of her veins out. My mom's stomach had burst and she was going septic. Her stomach has swelled, causing her band to fold underneath, cutting circulation to the bottom part of her stomach, and it died. She only has 20% of her stomach left. They said if she would have been at home when this happened she would have died because she wouldn't have made it in time. She spent 3 weeks in ICU and 6 weeks on regular floor. Since this has happened she's had blood infections, MRSA, staph infection, and a hole the size of a baseball where they cut her open because her skin would not heal. She's now in constant pain, has a pain doctor, and is depressed because of it. I'd like to say she's all better, but I know that she never will be. It sucks to say it, but I almost feel she should have died so she wouldn't have to hurt as much as she does now. She makes the same remarks and you can see how much it hurts her. The doctors say she'll be in this pain as long as she lives. Not a doctor. My mother started to notice her breasts were sore for no reason one day. She thought she bruised them in her sleep somehow and ignored it. Over the weeks it only got worse. She went to the doctor and they diagnosed her with mastitis and gave her antibiotics. The antibiotics ran out and the symptoms did not go away. After a few weeks of hoping the problem would just go away with time, she reluctantly returned to the doctor. This time the doctor found a lump, but insisted it was probably a calcified milk duct. They took their time doing a biopsy. When the biopsy came back, they said it was cancer, but not to worry, because it was caught early and highly treatable. A few tests later, they diagnosed her with inflammatory breast cancer. IBC is one of the rarest and most aggressive forms of breast cancer. No lumps, until it gets into the lymph nodes, cannot be detected by a mammogram, and doesn't show any symptoms until stage 3. The early symptoms are the same as mastitis, so it is often misdiagnosed, giving the cancer time to spread. The average life expectancy after diagnosis is about 6 months. My mom lasted about 2.5 years. I wanted to post this as a warning to women. You can still have breast cancer, even if there are no lumps, and you have normal mammograms. If you have unexplained bruises, redness, swelling, tenderness, and/or a dimpled orange peel appearance of the breast, see a doctor immediately. Don't put it off. It is possible to survive it, if you act fast. I got one. A few weeks ago I slipped on the ice and hit my head, on a Wednesday. I had a bad headache, but I've had concussions before, and saw no reason to rack up a huge bill, to be told to go home and rest. My husband talked me into going to the urgent care clinic 2 days later, Friday, and that doctor kinda blew me off, and made me feel stupid for going in, but said if it was still bad on Monday, call my regular drive. They wrote me an order for a CT scan Sunday, but told me a bunch of times they didn't think I needed it, plus it would have been really expensive with my ins, so I didn't go. My headache was still pretty intense Monday and I called my doctor, still didn't want to go, but was trying to shut up the people around me. They didn't see it as too urgent based off what the clinic had said, considering they didn't get me until Thursday, 8 days after I fell. After my doctor heard my symptoms, she was like, oh my gosh, we need to scan you like now. Finally got a CT scan. I fractured my faking skull. Gee, I'm glad it wasn't an emergency stupid urgent care center. My sense of taste and smell are still wonky, and my memory is kinda faked. I was leaking fluid out one side of my nose, but it wasn't bloody, so no one considered it urgent. I had a severe earache from the moment of impact, that was also totally ignored. I'm never going back to that clinic again. When I was 14, just having started high school, I started feeling really sick all the time. Not hungry, nauseous, tired, leg cramps, incredibly thirsty, just the works anyway. This kept going on for a while until the day before Easter vacation, where I woke up with a sore throat. My mother checked it out, and I had strep throat, but I had a shit ton of tests and quizzes that day, so I decided to buck up and just get through the day. My dad took me to the store. I grabbed an entire extra backpack full of Gatorade and Powerade. I was that thirsty, all the time, and I headed off to the school. The bus ride was absolute torture, and by the time I got to school I couldn't stand it. I called my mother, and had her pick me up. From there we went straight to the doctor's. He took one look at my throat, said that's not strep, and pulled out a glucometer. Checked my sugar and all it said was high. Turns out I had been a type 1 diabetic for 9 to 12 months, running at over 600 blood sugar for the first 6, over 900 for the rest of them. The doctors were surprised I was conscious, let alone still passing my classes. My blood ketones were so high that I had been burning the very blood vessels apart due to ketoacidosis, and probably was 3 days away from dying/being in a coma. Fun fact, during my 3-day stint at the hospital, to lower my blood sugar/ketones, I woke up one morning and put my glasses on and then couldn't see. My vision is terrible, something like 20/200, but my glasses fix it, but not that morning. In a panic, I pulled my glasses off and discovered I could see. Turns out the lenses in my eyes had absorbed so much sugar while I was detoxing that they had warped and corrected my vision. I had one beautiful day of perfect vision before they returned to normal. Not a doctor, but am currently undergoing an experience very close to what this thread is about. I have a bunch of moles on my back. I bumped one of them badly, and it started bleeding badly. Well, I knew that bleeding mole was a definite warning sign, so I went to see a dermatologist. He said that the mole was fine, and I had just hit it at a really bad angle, but that the mole right above it was showing all sorts of warning signs. Partially raised, discolored, uneven border. and should get removed. Not just because of the warning issues, but because it was on my back in a spot where it would be hard for me to regularly check it. I was in the process of moving to a new city, so it took me a while to set up an appointment for it to get snipped. A few months ago, I had a regular physical and the doctor for that said I could come in and make an appointment for her to snip it out. She took a look and agreed that it really should get removed, but like the dermatologist, she didn't think it was incredibly time sensitive. I was very busy, so didn't end up having that appointment until this Tuesday. She took one look at the mole and the first thing she said was, "Huh, it looks a little bigger than I remember it." So yeah, that got cut straight out, and I'm now waiting to hear back from the pathologist's report on it. Like almost everyone here, I'm not a doctor. But here's my story anyway. This past October, around Halloween, I had major lower abdominal pain, mostly on the right side. I assumed it was constipation, because the mail wasn't being delivered, if you know what I mean. After a week with no improvement, I went to a local clinic and the drive checked my appendix, which was negative, and said I had a minor blockage of feces. Gave me a short course of antibiotics and some laxatives, and sent me on my way. A month later, the week of Thanksgiving, I had more lower abdominal pain, this time focused on the left side. I went back to the clinic and the same drive said it was probably diverticulitis. He gave me a longer course of antibiotics. Some herbal laxative thing told me to follow up with my primary doctor. Cut to 2 weeks later, and I've had a CT scan of my abdomen. That evening I get an urgent call from my PCP saying I have a fistula, a hole tunneling through the bowel to the small intestine, and needed to go to the hospital right away. I didn't have any nausea or fever, just discomfort, so she said she'd get me an appointment with a GI specialist, and that I should go there if anything changes. The GI drive examined me, and said I needed to see a colorectal surgeon within 24 to 48 hours. He put me on a liquid diet, which I stayed on for 3 weeks, lost 20 pounds. The surgeon was a bit surprised at my lack of symptoms, and said I definitely need surgery. This was the week before Christmas, so I knew that surgery wouldn't be happening right away. On the 23rd I started having pain again, so I went directly to the ER. Had a second CT scan, and they found the same fistula on the left side, sigmoid colon, and a tethered portion of the small bowel on the right. Point at my next visit with the surgeon, he suggested I might have Crohn's, which would make surgery very difficult. I had to send off a blood sample to CA for genetic typing to confirm whether I had the markers for IB/Crohn's. Thankfully, that came back negative. So now I'm scheduled for major colon resection surgery next Thursday to take out the portion of my bowel on the left side that's bad, and possibly part of the small bowel on the right side, near the ileum. What I thought was just some constipation turned out to be major complication with diverticulitis with a hole in my colon and my small intestine. 6+ weeks of recovery and a liquid diet, so probably more weight loss. I never had any problems before October. I missed all of the holidays from Halloween through New Year's due to my pain. I'll be missing Valentine's Day too. But, thankfully, I haven't had any sepsis and I don't have Crohn's, so overall this has turned out much better than it could have possibly been. If my bowel had ruptured, I would be in much worse shape with the need for much more extensive surgery. TLDR, thought I had constipation. Turns out I have a hole in my colon. Will need major surgery to fix it. Not a doctor here, but I have a sob story for you. I took my cat to the vet last Wednesday to get vaccinations and dewormed. Got talked into getting him fixed as well. Came back the next day, he was running a temp of 104. Normal for a cat is 102.5, and he seemed really lethargic. They kept him an extra day to monitor him. I picked him up the next day, and he was still running a temp. They said I needed to keep him indoors and not to let his cone off. He was still really lethargic for the next 2 days. Sunday morning rolls around, and he had gotten his cone off, and was purring and happy. He jumped on our bed, and slept between me and my wife for a few hours. I check on him, and notice he stinks, and I can't wait to give him a bath on Wednesday. I turn the light on and notice there is a giant faking hole right next to the neuter site with pus and blood slowly draining. We take him to the vet, and they worked on him. Turns out that he had gotten into a fight probably a week and a half ago, and had developed an abscess near the base of his tail. They cleaned it up, gave him fluids, and said that he is going to have a rope unwound for the next 2 weeks that we have to clean and let drain. This is really gross. We are dealing with a hole in my cat that is steadily getting worse, so I take him back on Tuesday for a check. The hole is like 4x bigger than when we left. The vet checks him out and notices that there is fecal material in his wound site. Her and resurgeon re-examine him and discover that the abscess caused an infection that damaged his colon. Not on the same level as some of these responses, but I came back from 5 months in traveling in Africa about a year ago. Felt a bit unwell when I go back, but I put it down to climatization. 45 deg point C to 3 deg point C in a day. A week went past where I felt progressively worse, so I went to my local AE unit. A little wait later, and I got seen too. They ran blood tests and the usual tests, and came back a short time later with a rather worried look on their faces. They proceeded to ask a million questions about minute little details, while taking more and more blood. From my hospital bed, I could see my doctor constantly on the phone, while he kept looking over to me. Cue panic starting to set in. Short while later, a new doctor arrives who works at a different hospital about 30 miles away. Cue another million questions and more blood being taken for testing. They come back about 2 hours later, about 6 doctors and nurses in total, and basically tell me that the levels in my liver are 3 to 4 times that they should be. I'm having liver failure and have done for a short time, and they have no idea what's causing it. From all the questions and tests, they finally come to me and inform me I have something living in my liver. A parasite that's eating me inside out. I was pretty much a sideshow for the next 2 weeks as various doctors and juniors came from other parts of England just to see me, as they hadn't seen this before. Finally pumped full of so many different drugs just to see what would work. I spent 3 weeks in ICU before they let me home. I'm mostly recovered, fit and healthy bar I can hardly drink alcohol without being smashed within a few pints. TLDR, got a parasite that started to eat my liver from inside out. Nearly killed me, but better now. Not a doctor too. Happened to me. I was helping my folks with some yard work during finals and wound up working really hard. My upper legs felt a little strange and lower abdomen was a little tingly, but nothing bad. It went away overnight. I woke up, passed my finals, and patted myself on the back for several jobs well done. A friend was visiting from out of town a few days later, and one morning, while they were there with me, I felt the worst pain in my life. Took me completely off of my feet. It seemed to fade after a few hours, but would ebb up and get worse, then go away for no apparent reason. I went to the campus doctor, America, and I had no insurance at the time, and they were stumped. I got these pains that lasted all night. Noticed shrinkage in places, and my left foot started turning outward, and I had to learn to walk in a way that corrected it. The only relief I got was wearing athletic support 24/7. But it was relief, and only a little. Graduated suffering from it, got a job, got a different job with benefits, and went into the doctor. Nothing wrong. Let's do a series of extremely painful manual examinations. HMM. Still nothing wrong. Off to a specialist. Let's do the same manual examinations. Extremely painful? That's weird. Can't find anything wrong. Ultrasound? Sure. HMM. Nothing wrong. Must be in your head. Lived with it for 5 years. Got a government job with amazing benefits. Called up the insurance one day, and with my girlfriend's advice, told the lady on the line that I needed a doctor known for patient advocacy. Told her my relationship was almost over because of a lack of being able to get my girlfriend pregnant as we were formally getting our lives together. Milked the story so much I had the girl in tears. She got me in contact with several different departments at the insurance company, and they gave me a name. New doctor. I think I've seen this before. Let's do an x-ray. Now go home and eat things with the most fiber you possibly can for 3 days, and let's do another x-ray, and I'll send you to a pain specialist and the results to that doctor. I go to the pain specialist. Yeah, you have a double inguinal hernia, one of the worst I've ever seen. Let's get you in touch with the general surgeon. Now, general surgeon, we are upgrading this to an emergency case. Call people you love/trust. There's obvious necrosis starting. Should only be an hour surgery. I wake up 4 hours later on final consult with the surgeon. I probably shouldn't tell you this because I'm a doctor, but you should probably sue the primary and secondary doctors and their associated hospital for negligence and malpractice. Now, I'm still healing from the surgery. I can lift pretty much as I want, but there's still lingering pain while the muscle tissue heals. It'll be a year before I'm totally clear, but it's so much nicer living without constant pain every moment of my life. A friend of mine started complaining of a headache one day, took some over-the-counter pain meds, and tried to sleep. She woke up in major pain. Anything touching her head made her scream. Her skin was a yellowish color. She ended up being a bit jaundiced. Her mom took her into the hospital and they rushed her in right away. Ended up giving her antipsychotic meds for the pain in her head. She told me this part because later on she thought it was funny. Went through a ton of tests and they found out she had some kind of unknown blood condition where her white blood cells were attacking her red blood cells. She said something about the doctor telling her that her platelets were at 15 and should have been somewhere in the 100s or higher. I'm not sure exactly. She had swelling in her skull, which caused the severe pain. She now has to go for monthly plasma transfusions. It's been a few years now, and the doctors are still tossing out possibilities for what she has. They definitely want to remove her spleen. She's also been told she could potentially have lupus. The transfusions help, and her platelets remain at a normal level. But she has to be careful if she falls, because she could get severe internal bleeding and not be aware. Or if she cuts herself, she generally needs to go to urgent care because her blood doesn't clot properly. Not a doc, but stories about my parents. Dad skipped a few years of getting physicals, including SAT tests. Just never got around to it, too busy, etc. When he finally went in, his SAT was off the charts. Long story short, stage 4 prostate cancer, metastasis to bones. Gleason score 6. Put on meds, basically chemical castration. Has been on a number of treatments of all types, some stopped working, tries something else. Was diagnosed about 8.5 years ago. He is doing pretty well, especially considering how long it has been. Still active. Not sure how much longer he has left. He's 65 now. Mom hates going to docs. Spouse and kids have to nag her to get routine checkups, mammograms, colonoscopy, etc. A couple months ago, she finally decides to go have a growth checked. Thought it was probably a hemorrhoid. Doc, not sure, but says it should be removed and biopsied. Mom tells me she's having surgery to remove it. This is the first I hear of it. Diagnosis, melanoma. Another surgery to make sure they had clean margins. Brain scan, clean. Sentinel lymph node test positive and another surgery. Then another surgery to remove all the lymph nodes in the area. Just found out yesterday that they all came back clean. My mom was in tears on the phone with me. She was so relieved. Has to decide now if she does any chemo, etc. To be super aggressive about keeping it from coming back. We'll see what happens. Hasn't decided yet. She later told me after I asked that she had waited probably 6 months with this apricot-sized growth before going to the doctor. Both my parents are now strong advocates of going to the doc if something doesn't feel right. TLDR. Both parents waited too long for routine tests or doc visits. Both diagnosed with stage 4 cancer. Moved back to my uni flat on the 2nd of January. Had a bit of stomach pain after cooking a meal. Thought I gave myself food poisoning. After sheeting my brains out and trying to fold myself into a ball, I called the NHS helpline on 111. The woman told me it's probably nothing and she'll get a doctor from my local practice back home to call me. The phone rang and it was a nurse who told me students have bad diets. You probably need to exercise more. I thought I was overreacting, so just went back home. 50-minute drive and got into bed. For the next 4 days I sweated and vomited until the early hours. Finally on the 6th I went to the doctors, who lay me down and flicked my stomach. I actually yelped. He said the appendix has a small hole in it. He told me to go to the hospital and get it removed. They'd be waiting for me when I get there. Instead my mum and I were waiting in fridge for 4 hours. By this point my appendix erupted and I literally can't describe the pain. They finally forced a cannula into my arm and took me to a ward. 7 hours later I go down to surgery. So after 11 hours total waiting I get it taken out. What was supposed to be a 30-minute job took 3 hours as the appendix turned gangrenous and had started eating away at my kidney, intestines, and stomach. They said they got it all in time and I'll recover fine, but I spent the next week on oxygen, morphine and antibiotic fourths. I came home last week and got a phone call from the surgeon. She wanted to know how I was doing and that it was ridiculous how unprofessional the nurse and the helpline were. Apparently if I waited another 2 to 3 hours to go to surgery I would have lost my intestines to infection point. If anyone gets stomach pain, please, no matter how severe, just gently press your sides in. If the right hurts more than the left, go to a doctor. It could literally save your life. This was in 2008. When I was 11, I got flu mist and became sick about a day later. I said I'm fine and went to school. This continued as normal for a few days. About a week later, I was feeling worse and worse and decided to stay home. I developed a hell of a cough, so my parents took me to the doctor, a pediatrician working in a private office. Oh, he's fine. He just has pneumonia. He prescribed me some antibiotics and sent me on my way. I went home that night and had a heat flash. Bad. Really bad. My temperature spiked to 107. My parents gave me an ice bath and took me to the actual hospital. Same thing. I had pneumonia. I missed school for about a month and slept on the floor because the air conditioning vent was right there and kept me cool. After a while, I stopped eating entirely for about 2 weeks. I couldn't sleep, eat, or talk. I stayed awake for about a week straight and began to have severe seizures. My parents naturally took me to the hospital yet again, and they again sent me back due to complications from pneumonia. I magically felt better one day, so went for a walk. I returned quickly, having a severe headache. I went to sleep for the first time in about 3 days or so, and woke up screaming. I had the worst headache of my life. It felt like a bodybuilder was pounding a sledgehammer as hard as he could in my skull. I attempted to get my dad's gun, just because the pain was so bad. He stopped me and took me to the hospital yet again. Same goddamn thing. That night, I lay in bed and was having severe seizures. This time, my parents drove me to a different hospital. They put me under with ketamine, fun sheet, did a spinal tap, and gave me a cord scan. I had acute disseminated encephalomyelitis, ADEM, one of the worst forms of encephalitis. My brain was swollen to almost twice its size and was literally compressed against the sides of my skull. They flew me to a hospital in Delaware and I stayed there for about a month and a half. I'm extremely lucky I didn't die and suffered only minor brain and nerve damage, which gets better as the years go by. 2015 is here and I'm still not fully recovered. Not a doctor and this story isn't as great as some of the others, but I thought I'd throw my 2 cents in. I'm bulimic, and I was really deep into my sickness back in 2009 to 2010. I had lost 110 pounds in 9 months. I was having a lot of chest pain, but I didn't think it was such a big deal. No clue why I was so delusional. The chest pain would come and go, and got worse and worse, to the point where, when I would have an attack, I would be gritting my teeth so hard it felt like they were going to shatter in my head. I started going to the ER for it, and they sent me away time and time again telling me it was just really bad heartburn. I figured they were right because bulimics get bad heartburn, but it still shocked and amazed me that heartburn could be so fucking mind-blowingly painful. One day I went in for the excruciating pain, and they sent me away again with some painkillers. I took them, and a few hours later I was having another attack on top of the painkillers. That made me want to call 911. I drove myself back in, and some other doctor, who I had not met before, and was one of the only ones who didn't know me by name and immediately roll his eyes at seeing me. He did an MRI of my gallbladder. Guess I'd been passing gallstones and now there was one so huge it had impacted, and I had gone septic. Went in for emergency surgery, and they had to take it out. I almost died. Went a little over 4 years without relapse after that. Don't fuck around with bulimia, folks. It can kill you. Get help. I went into the ER with a pain right under my ribcage. X-rays were done. It looked like I had gallstones. They admit me and put me on blood thinners for 2 days to prep for surgery. They remove my gallbladder and send me home 2 days after. The surgeon tells me my gallbladder didn't feel like there were stones in it when he palpated it after removal, which was unusual. The necropsy of the gallbladder would come back in a week, and it would show for sure what was wrong 2 days after getting home. I bent over, tried to straighten up, and started to black out and hyperventilate. Call an ambulance. Apparently I'm blue and anoxic. They rush me to the ER. They do an MRI, and it turns out I have massive blood clots almost everywhere, especially in my lungs. I had been bedbound for several months due to a spinal/nerve injury and developed DVT, which spread clots everywhere. I ended up in ICU for a month. The team of doctors that treated me said, when I was admitted, I was within 48 to 72 hours of certain death. I now have a filter in my vena cava to prevent this from happening again. Luckily, the blood clots went fully away, no damage to my lungs or other organs. The necropsy of my gallbladder showed that I had no gallstones. It was full of blood clots. I'm happy to be alive, but pissed that I lost my gallbladder. From Hurricane Sandy, I thought I had food poisoning, having diarrhea non-stop. My son told me to go to the ER. I was told I had non-alcoholic fatty liver disease. I went a week later to get an x-ray. I was told there is no function at all in my gallbladder, it's dead and must be removed. Then the surgeon messed up my surgery, he sealed some valve. I lost 38 lbs from that. I went to another surgeon to fix it. He said because I have lower right side pain he might remove my appendix. While he's in there, he took out my appendix and sent it to the lab. There was cancer on there. So I went to a cancer surgeon, had surgery again. I had fallopian tube cancer. It's a rare cancer, less than 1% of cancers is fallopian tube, and there is only 10% cure, and it was metastatic to on my appendix, small intestines, and my omentum, stomach lining, and a few other places. So, I had a total hysterectomy, and my omentum was removed. A few days after surgery I had a hernia, but they couldn't operate on the hernia because I had to do chemo. I beat cancer, so I went to have the hernia operation. 9 months later the X-ray showed I had 2 hernias, not 1. So I had the operation. Had 30 tacks put in because I had a mesh that went around my entire stomach. A tack was put in my nerve and the doctors insisted on me going to pain management. One wanted to riddle me with drugs and the other wanted to riddle me with needles. I didn't want either, so I lived with a horrible pain for 6 months. I couldn't walk normal. I went to a surgeon to remove the tack that was bothering me. He opened me up and closed me and nothing whatsoever. He said he didn't feel it was a good idea at the time. I went to another surgeon a month later, and after surgery 2 days later I found out there was cancer again. The fallopian tube metastatic cancer came back, but it was Christmas time and then New Year's, so the doctors did nothing for me. Now tomorrow, I'm starting chemo to kill the cancer for a second time. Again, not a doctor, but this happened to me. I used to wear contacts every day, and I took them out each night and cleaned them thoroughly in the recommended solution. Usually I switched to a new pair, disposables, about once a month. Right around the time I was going to colleges for visits, read, allergy season, my eyes started really giving me hell. Hard to look at bright lights, painful, watering a lot, you get the idea. This went on for a couple days, but I figured it would pass. Allergies, right? No big deal. Fast forward a week, and I'm in the ophthalmologist's office after my symptoms had only gotten worse. He tells me if I had waited even a few more days to come in I could have had permanent vision loss and prescribed strong steroidal eye drops to be taken immediately. Turns out I had developed several nasty corneal ulcers due to an immune response my eyes were having to the lenses. Apparently this occurrence is often associated with the onset of an allergy and causes a buildup of certain proteins inside the porous material of the disposable lenses. This high concentration of proteins inside the lenses caused my immune system to freak the hell out, thinking there was some kind of foreign organic material in my eye. It then unsuccessfully attempted to assassinate the contacts and only succeeded in nearly blinding me. TLDR, contacts that granted me sight nearly blinded me. Not a doctor. It happened to me. I was in high school and started throwing up every morning. I'm already diabetic, so I went to the doctor. Diagnosed with gastroparesis, occasional stomach paralysis pretty much, and was sent home with medication and a reprimand to take better care of the diabetes. Problem was it kept happening every few months. Went back to doctor, he claims it's totally normal, and I'm again warned about diabetes care. Then a new symptom, I have stomach pain so bad it makes me writhe uncontrollably, and my white blood cell count goes way up. Go to the hospital, throw up, and suddenly everything is fine, and I'm sent home. This continues on and off until college. I go to see tons of specialists at some of the best hospitals in the area. All of them tell me there's nothing wrong beyond the gastroparesis. I take a bunch of tests and no new information. Finally I see a new doctor who tells me I need to have exploratory intestinal surgery. Just open me up at the top and work their way all the way down. Opened me up, and 2 feet down was a latticework of intestinal wall that had grown across the opening like a sink drain. Food had been getting caught, backing up into my stomach, and starting to rot. Fortunately surgery went awesome. Stomach back to digesting cupcakes and pizza. Not really. I'm still a diabetic. But lesson learned. A Cam's razor isn't always a thing. To cheer up the hypochondriacs, I've got a story that's the opposite of this thread, something that the doctors thought was scary, but turned out to be nothing at all. I went to the doctor about flu-like symptoms, coupled with abdominal pain, because I had meningitis as a baby, and ended up with a shunt in my brain. They tend to be extra cautious when I get sick. I had to have lots of fun blood tests, one of which was a test for liver function. It came back that my liver was not coping well at all. Now, I have a history of depression and tried to kill myself via overdose a couple of times. There was no immediate damage, but the doctors were worried that I might have sustained long-term injury from putting my liver under that much strain. So more tests were ordered. A few days later I was called in for an emergency appointment because my liver function had got worse. Next thing I know they're booking me in for more blood tests and an ultrasound before my liver gets so bad I turn bright yellow. Fast forward 3 days. I go in for more blood tests and it's safe to say everyone's pretty freaked out by this point. My liver function's being tested again. I'm being tested for hepatitis A, B, and C, and it's all pretty worrying. Now comes the relief. Today I went back to the doctors to get my results. I was almost certain they were going to tell me that my liver is dying. But oh no. It turns out one of the doctors had a bright idea of testing to see whether I had any other random infections. Long story short, I have glandular fever. Completely treatable, given time and rest. My liver function is going back to normal, and they are certain my spleen won't pop now. So the moral of the story is, sometimes things seem worse than they actually are. Gonna be one of those guys. Here. About 2ish years ago I had some pain in my chest. Less uncomfortable than heartburn even. As a somewhat recent ex-smoker I wrote it off as pain related to that point. Then I fell asleep on a laser boy, but the raising leg part was only half deployed. Woke up hours later with my entire leg from the knee down asleep. Took a while for the feeling to come back. Another day or two goes by and now I have what feels like a knotted muscle in my leg. It's bad enough I see a doctor see why it hasn't gone away. He says hi after hearing of the chest pain and orders an ultrasound on the back of my knee. I call it an elbow. A few minimums after that a doc came by and told me to call someone to bring me some clothes and books and stuff cause I wasn't allowed to leave for a few days. Turns out I had a deep vein thrombosis or a blood clot blocking off a vein or artery or something in my knee, which was causing the calf pain. They never confirmed it, but when I was put on thinners the chest pain went away, so they said they assume I actually had a pulmonary embolism, clot in the lung, which threw a piece off, and that piece got caught in my leg. Not saying it's always fatal, but both DVTs and PES can be, if they aren't treated, and the underlying cause keeps adding more to the clot. Anyway, $1,600. In self-administered to the stomach blood thinner needles and months of warfarin later, and I'm good to go. I guess I'll do my own example. It was when I was 15, turning 16 about 4 months later, currently 23. My parents were out to a wedding reception and having fun. I was sitting at the family computer, obviously had a laptop of my own now, and I got really lightheaded and my heart was racing. I thought maybe I was sick, maybe I was gonna throw up. My parents came home by 11. This started at 10. My dad's like, "Meh, it's nothing. Just lay down and relax." My mom took my heart rate. I was 180. So I laid with my legs above my chest, seeing if that'd help. It eventually never got better, so around midnight, my mom drove the 2 miles to the hospital. Knowing something was up, we get there, get the paperwork started, walk into the little interview room, where they take your temperature, your heart rate, how you're feeling, get your history, and she is watching the monitor behind me. "We are gonna have to stop this now, and get you into a room." I'm like, "What?" They put me into a cardiac room, change my clothes, and hook me up to and forth. Turns out, my heart rate was 235 BPM. Keep in mind, I'm only 5'1", and I was maybe 5'0" at the time. It shot up to 250s in the room. They try to massage my lymph nodes on my neck, make me push down, like I was bearing a child, or pup. Nothing. The doctor tells the student doctor to give me the medicine to help. Shove it into the fourth. What? My body tightens up from head to toe, then released. Heart rate back to the 90s. Relatively normal. Turns out it was a tachycardia problem, AV node re-entry tachycardia, where the AV node's electrical signal cycles back, causing the heart rate to go faster and faster. Luckily, I got it fixed 2 months later with catheter ablation, and haven't had any heart issues since. Quick edit. Mother has a similar issue, but she can handle hers by doing the 2 above examples before the medicine. Yeah, not a doctor, but spring finals during my junior year of college. Woke up one night with a massive headache, so I popped some ibuprofen and went back to sleep. I had a final in the morning. When I woke up, I felt like I was getting sick and popped some more ibuprofen and went to take my final. During my final, I started feeling really nauseous and decided to finally go to the health center to see if they can give me something to make it through the next few days of finals. I go to the health center and they surmise that I probably am having a migraine from stress, lack of sleep, etc. They prescribe me some migraine medicine and I go to sleep it off. Again, I wake up at about 2 AM with excruciating headaches, nausea, and body pain. Since I couldn't go to the health center again, I have my roommate take me to the ER. I definition couldn't drive. At the ER, they had to put me on a double dose of morphine to dull the pain. After consulting with some other doctors and nurses, they ordered a spinal tap. All in all, I was diagnosed with viral meningitis. Doctors sent me home after spending some time in the ER with some painkillers, and I was told I would be alright. Apparently, if I had bacterial meningitis, I would have had to be quarantined, and the whole incident could have turned out a lot worse. Still no idea how it was caused, but I still get phantom pains where the 10-inch needle stuck my back for my spinal tap. Never trust a headache. After hearing doctors and nurses complain about how 90% of their patients are full of shit, I'd like to hear the opposite situation. A doctor or nurse who thought a patient was making a big deal out of a cough, and it turns out the patient was right. Maybe such stories would humble medical personnel and make them realize the dangers of a biased attitude, whether it has a basis in truth or not. I had this happen when I complained of a painful throat and difficulty swallowing and breathing through both my mouth and nose. It wasn't until a specialist, because it kept getting worse, stuck a camera down my nostril, that we found out it was severely infected in an area just a bit under my tonsils, along the back of the throat, and in the far back of my nose, apparently right before it connects to the throat, or whatever, because none of the prescriptions the other doctors gave was for bacterial infection, since they thought I was just complaining about the common cold, a viral infection. The specialist said if they had done a proper check when I went to the hospital last week, the infection wouldn't have been so bad. When I finally saw him, a shot and prescriptions for bacterial infection worked. Took several weeks to get rid of everything though, but at least I was breathing much better by the second day. Once had severe flu-like symptoms for about 3 weeks. I didn't think anything of it until my mom mentioned something during Christmas dinner. That night, I woke up screaming with pain in my chest. It felt like a muscle spasm from coughing so much. Went to the hospital the next day. They took chest x-rays and diagnosed me with pneumonia. Was admitted into the hospital for treatment but the antibiotics weren't working. I also had an allergic reaction to the concentrated antibiotics that were distributed via forth. After a couple days of not being able to figure it out, the doc finally asked if they can do a lung biopsy. I agreed. A lung biopsy was done at the same time as the MRI scan, so they can pinpoint where they'd stab me through the back with a giant needle to get lung tissue. Had to be on watch in case my left lung collapsed from the biopsy point. Test results came in. Was diagnosed with blastomycosis. It's a rare fungal infection. It happens when you breathe in spores that just so happen to be in the air. I was hiking a lot at that time, so it could have happened during any one of those trips. The infection also incubates for several months before you experience symptoms in Aho. Was put on antibiotics for 9 months and was cleared. If it wasn't for the biopsy, they couldn't get any other positive results from other samples. I could have possibly died. The infection at that time had taken up about 60% of my lung capacity. It was very hard to breathe and pretty much do anything physical for a while. But I've been great ever since. TLDR. Hospitalized for pneumonia. Turns out it was blastomycosis. Lot of antibiotics for 9 months straight. My grandmother died last March, and the cause of her death was totally unexpected. She had been a smoker since the age of about 15, and we had prepared ourselves for the doctor visit that would tell her about cancer, since she had already been told she might have COPD. She got real sick and started having crazy chest pain fits for a couple weeks, and one day I had stayed up all night with her and went to sleep right before she did at 10 o'clock and woke up around noon to ambulance sirens. My younger brother, sister, and I were told to stay in the room. Finally my dad came in and told me that I needed to watch the kids as my grandfather, aunt, and him went to the hospital. And when they came back my dad came in with her cane and I knew she was gone. She had gone to the hospital a few days before for her chest pains and came home saying that it was nothing. 2 weeks later, when we got her death certificate, it said that a blood clot from her leg passed into her heart and put her into a heart attack-like state. She woke up puking blood and told my grandfather calmly to call 911 as if she knew this might be it. Then the paramedics showed up and got her on a sling. My family said they knew she was gone when she used the last of her strength to get on the sling and went limp. I was devastated and had lost a woman I knew for only 14 short years. During my parents' split, she became my mother, since I despised mine at the time. I miss her every day, but try not to grieve too much, since I know she was in so much pain and I feel selfish to want her back. I still sit out in the garage, where we spent most of our time. That's where my grandparents began to smoke, when I was born. And I have conversations with her from time to time. I only cried once within the first few months after she dies, and that was when I received the news. I was too depressed to even cry the rest of the time. I don't even remember much from the following weeks. Jesus, that woman made me laugh more than anyone I've ever known. I miss her, and will continue to miss her, as long as I live. My best friend thought he had the flu. It was everything he could do to walk the high school graduation ceremony. A few days later I went to his house to hang out and see how he was doing. He was still sick, but he didn't think there was anything wrong. Then he had a nasty coughing fit and suddenly got really distant from that point on. When his mom got back from work, she asked him how he was doing. Turns out he had coughed up blood once or twice. For 2 weeks he was in the hospital, and they had no idea what was wrong with him. They decided on pneumonia. The antibiotics worked a little, but he was still getting worse. They had to put him in a medically induced coma from how bad his coughing got. Then, by what I can only assume was with the help of the internet, they went with a rare type of fungal infection. Thankfully they had it right. After another 2 weeks of coma and getting him out of ICU, we were able to see him. There is only one thing more powerful let you know your mortality exists than being 18 and graduating high school 3 weeks ago and seeing one of your best friends 60 pounds underweight and hooked up to 3 machines by about 8 tubes, and that is being that guy. This guy is the happiest, carefree, most sarcastic asshole I've ever met, and when my 2 other friends and I walked into that room he was in tears. It's not a fun thing to hear a dude breathing through a tube crying. A week later he was in physical therapy relearning how to walk. Today, a year and a half later, he can't run more than a quarter of a mile without being winded. TLDR, if you're coughing up blood, go to the hospital immediately. Not a doctor, but my husband started noticing some weird little things, like how, if he cut himself shaving it just would not stop. He's a chef, and one day he cut his fingertip off and had to get it cauterized like 3 times and it still wouldn't stop bleeding. He goes to the doctor, and after some tests he's told he's just a tad low on platelets, but it's no big deal and it'll be monitored with monthly blood tests, but this is something that'll just stop on its own. Meanwhile I start noticing things like this weird tiny clusters of spots around his ankles and these seemingly permanent large bruises over both his hips and outer thighs. Still, no biggie, says the doctor. A year of monthly blood tests later his impacted wisdom teeth are finally becoming an issue, and he sees the dentist, who schedules surgery to remove them. During the conversation about risks and illness and sheet, my husband says, "Oh well, about a year ago I had low platelets, but it's not an issue now," and the dentist hems and haws for a minute, then tells him that, just to be on the safe side, he'll have him get a blood test and send the results to the hematologist, just so he has his covered. The hematologist is the only one in the area and has a wait list of a year to get in for an appointment, so this is just formality. Husband goes to the lab, and in the time it takes him to drive home from the blood test, about 15 minutes, a message has already been left on the machine from the hematologist saying, "Get in my office at 9 AM tomorrow." Hematologist says his platelets were under 15, as in, approaching hemophilia levels. By that afternoon he was on terrifying cancer drugs you can't even touch with your bare hands and a whack of other pills, scheduled for transfusions and surgical consults, trying desperately to put his levels back up to where he'd not be at risk of bleeding into his brain if he bonked his head. It was absolutely terrifying for about 5 months as we watched everything fail to work and start to get there. This treatment will reduce your life expectancy by at least 15 years. Conversations. Last resort was a splenectomy, which, thankfully, did work. He's been healthy for years now. The doctor had been seeing the red flagged blood tests coming to him for months and not said anything, even when we called in and asked. His impacted wisdom teeth saved his goddamn life. Also those mysterious large bruises on either side of his hips and thighs? Those were the imprints of my legs when we had sex. I know this is not appropriate, but I don't know what else to do. Please help if you have a medical education specializing in the chest. I'm freelancer, so I don't have insurance. For the past few years I've had traveling pains in my chest that would go away if I pressed on it / massaged it away. It would be temporary and the pains would be fleeting, but they come back once every few months. It's mostly on the right side and in the front. I've noticed now that the pain sometimes shows up in my arms. It just pops up and goes away. Literally a second, and then it's gone. But sometimes it lingers longer and sometimes the pops are frequent, but they don't stay for long. I do have a cough, but I have chronic bronchitis since I was a kid, but I cough maybe once a day to clear the mucus and it flares up a bit during the winter months, so it's been a bit more noticeable. My pup is fine, I think. I did a somewhat intense yoga routine a couple of days and ever since then my torso has been really weird, making me nauseous and a little burning sensation where my diaphragm is, and the tiny pops of traveling pain have returned. Also, I self-diagnosed myself with costochondritis a few months ago, and it's gotten a lot better, but I've been taking anti-inflammatories, so maybe my stomach is acting up and that's why I'm sensing burning near my diaphragm. Maybe the yoga triggered the costochondritis? I don't know, please tell me it's not cancer. Just to be fair, I was an occasional smoker, 1 to 5 cigs a week, if I was really stressed, up until a few months ago, and I smoke a little pot before going to sleep, so I don't know if my lungs just get irritated with the smoke, or if it's more than that. I've always thought that, because it goes away it's not a big deal, and hope that it was normal, but I'm freaking out. Please give me some advice. I don't know what to do. I'm really scared it's cancer. If you think I need to go to the doctor, what should I do? I don't have insurance. I have savings, so I feel like running to the doctor right now and just dealing with things later. I know this is a rant, but I'm terrified. My mother went into her doctor because she had been feeling tired and not very well. They sent her to do a scan. The nurse who did the scan didn't see anything, and so she decided to move the scan up just a little further, even though she wasn't supposed to, and could have lost her job for it. But when she did this, it came back that my mother had two aneurysms in her aorta. They were planning on doing a surgery in a few months in our hometown. A week later I received a call at work that she was being life flighted to the most prestigious hospital in Houston, Texas. She was going to be having emergency surgery in 15 hours. I made it down to Texas driving for 13 straight hours. We got there right as she was going under anesthesia. 10 hours later she came out of surgery. I was the first to be able to go and see her. She was kinda of awake, but not really, and something seemed off. They ended up putting her into her own personal room because things weren't looking good. Finally, a few days later things were getting better, so I had to head back to my place of work. A few days later my dad called me to tell me she had passed away because the machine she was on made her brain bleed. She passed away 4 days before her 44th birthday. Turns out she had a rare condition that forms aneurysms throughout the body and it's hereditary. So now for the rest of my life I will be getting tested every so often to make sure I don't get it. Edit. Also forgot to mention that almost a year before she found out about the aneurysms she had had surgery due to another rare disease she had, Stevens-Johnson syndrome. They had to take out a good portion of her colon as it had leaked into her abdominal cavity. The doctor who did the surgery did scans before the surgery to figure what was really going on. This doctor saw my mom had aneurysms and didn't tell anyone. Not a doctor, but thought it's interesting enough to post here. PS. NSFW for people who don't like pus and blood. Was on first overseas holiday in Europe when I woke up with a sore tailbone after New Year's in Rome. Fireworks were insane, by the way. I shrugged it off, and my family and I continued our holiday. It wasn't until we stayed overnight in Venice that the pain got bad, and we were going to go to a general doctor to check it out. We left, then went on a train to Austria. We arrived at 10 p.m. and we had a friend's second house we were staying at. They have a house in Austria and Switzerland. Because we were all really tired we decided to go to the doctor's in the morning to get me checked out. So the next morning comes, we get in the car, and I had trouble sitting, so I was lying down on my stomach in the passenger seat while dad drove. It took about 45 minutes to find the doctors, and when we got there it took 2.5 in the waiting room. But when we finally met the doctor we told him what happened. He asked me to look at the area where it's sore, expecting him to see a bruise or something small, but instead there was pus starting to come out of an abscess. I think that's what they told me. Anyway, he says we need to get to the hospital immediately, so we rush into the car and get there. I'm half leaning on mum, hobbling, while dad rushes ahead to find where we need to go. Once we found the place we needed to talk to a lady and fill out stuff and whatnot, but I've turned septic and now passing out. So doctors rush around and get me a bed. Then it gets a bit blurry, but I remember having to wait 5 or 4 hours for surgery cause I had breakfast, but I was just throwing up and passing out waiting. Surgery time came and they put me on like a metal bench thing and put the mask on my face. The surgeon told me to take deep breaths. 1, 2, 3. I was out cold. When I woke up I can't remember if it was a doctor or myself telling me that I just came out of surgery, but when my parents came in the doctor said they couldn't close the wound because it was too deep. So I spent 3 days in a hospital room passing out in the showers from cleaning out my wound. There was a lot of blood that came out, with Panadol for the pain and the first 3 seasons of Community to keep me company. So, while my brother and sister went skiing with my dad, mum and I were in the bar drinking and watching them. I was out for the rest of the holidays, but Austria was a last stop anyways, so it didn't ruin it too much. Best part about it was chicken schnitzels the size of a large dinner plate, and flying business home with all the free champagne I could have. Not a doctor, not exactly a trivial visit turned serious, but a worthy cautionary tale, especially for any doctors who are reading. About 5 years ago now, my wife started suffering really bad heartburn for a couple of days. She'd always been something of a heartburn sufferer, but this was really bad. Antacids and proton pump inhibitors just weren't touching it at all point. So she talked to her GP, who said it sounded like a viral thing. Give it one more day, it should resolve on its own. Closer to 2 days later, the pain had reached writhing on floor levels. So I said fuck this, and took her to the airport. The doctor there made me stay in the waiting room instead of accompanying her, did not let her give a history. I'll say that again, so y'all can fathom. He did not allow the patient to give a history. He just shut her down. When she tried to explain beyond bad heartburn pain, point gave her an ECG, which was normal. Point gave her a glass of xylocaine viscous and a script for Nexium. Told her to see her GP in a week. If no improvement, point the pain, which had subsided for a while, came back with a vengeance. So I said no, seriously fuck this so hard, and took her to a different across town. Point the doctor there listened to her damn history, said wheeled over the ultrasound machine, and booked her in for an emergency cholecystectomy. Point the op took a good 4 hours longer than expected. The thing was so swollen up they had to spend 3 hours draining it before they dared cut it out. The surgeon said that if we'd come in just a few hours later, it would have killed her, as she said in a strongly worded letter to the first hospital. Misdiagnoses happen, and nobody can catch everything. However, if you do not take a patient history, you will miss important things, and it will be your fault. Point. And if you ever don't let your patient give you a history when they are actively trying to, I will faking cut you. Point for the non-doctors in the audience. If the doc at the ear is an idiot who won't listen, go to another hospital right now. Was indoor climbing with a friend. He was the one securing me. After I reached the top, I wanted to go back down, and asking him if he was ready for my abseiling. Is this really the correct word? Non-native English speaker? Close bracket. At about 3 meters left, 9,8 feet, he couldn't hold the rope and let it go with me falling on the ground. Needed some seconds to comprehend what just happened and wanted to stay up. I tried to stand on my left foot, and it ached a little. Thinking I have sprained my ankle, I asked for some ice for cooling. Meanwhile, a lot of people were standing around me asking if everything was alright. On my side, everything was okay. I was just a little angry with my ankle, thinking it will sure hurt for a while. My then girlfriend was also there the whole time, seeing all, and was really scared. I told her it was just a sprained ankle, nothing to worry about. I just need some minutes so the swelling could go back. After about 15 minutes, I tried again to stand up, still hurting. I'm in the German Red Cross, voluntary, and thought about what I would saying to another person in this situation: you need to see a doctor. So I asked my girlfriend if she could drive me to the hospital. The owner brought me some crutches, and we started to walk to the car. In the hospital, they were doing some x-rays on my foot. After we finished, I was waiting for the nurse to bring the pictures, and I heard her trough the door shortly after she comes to me and says, "Mr. Taku-senpai, bad news, but the doctor will tell you everything." 5 minutes later, the doctor comes to me saying, "We need to operate you right now. It wasn't just a sprained ankle, it was broken and needed to be fixed with 5 screws." Not a doctor, but this happened to me. I came in with a sinus infection that turned into an acute or critical condition. At first they told me to go home and just rest. The second time I came back with both of my parents yelling to get me into surgery. I had an infection that was spreading through my head that was very close to getting into my brain. My mom did some research and found out that I was in a serious condition and needed surgery fast. When we arrived to the emergency room, they drugged me and made me go to the main building of Texas Children's. I was sent to a small room to wait for an extra room. It took maybe 4 to 8 hours to get a private suite. The hall was used for people that cannot stand light or any kind of sounds. I had morphine every single 4 hours due to the pain. I had 5 teams of 2 doctors checking on me, studying my problem. Apparently it has gotten to the point where I should have been in a serious coma. After 3 days of waiting for surgery and just fluids running through my veins, my dad finally had enough and made a big deal about getting the surgery now. They flushed the fluids out, and I recovered in 1 night after the whole surgery. After all that, my parents were talking about it to a doctor, and the main infection disease doctor said he was 2 hours away from a serious coma. God damn. Not a doctor, but a person who went with a stomach ache and ended up spending 6 weeks in the hospital. When I was 7 I suddenly started experiencing excruciating stomach pain and vomiting. Went to my doctor's office and saw a doctor, not my usual physician, who dismissed it as a stomach virus. After 36 hours without being able to keep anything down, my mom called my actual physician and said he needed to see me to see what was really going on. He told us to just meet him at the in case it was something serious, since he had an office in the nearby hospital. All I remember is him feeling my stomach for a few seconds, then calmly looking at a nearby nurse and saying something along the lines of, "Please get me a crash cart and contact the," or, "This boy needs surgery immediately." Woke up a few days later in ICU. Turns out I had Meckel's diverticulum with intussusception. In layman's terms, a piece of umbilical cord remaining inside me rubbed against my intestines, causing them to eventually tear open and then pull themselves inside one another. I had 2 colostomy bags put in. Imagine 2 sets of lips on either side of your abdomen, with a bag attached to both of them. To make matters worse, I was given penicillin, at which point doctors learned I'm incredibly allergic to it. I ended up getting an infection which I nearly died from, had complications for weeks, and after being discharged, had to have the colostomy bags on for almost 4 months. Before I was totally put back together. I have 3 big scars, one down the center of my abdomen and 2 smaller ones perpendicular to that from the colostomy. TLDR, if you're sick, go to your actual physician, not whoever is filling in for him that day. Stomachache turned out to be life-threatening intestinal trouble. 40-year-old man who was in excellent health comes into the stating that he had a bloody nose the day before, and he very rarely gets bloody noses. He decided to come to the even though the bleeding stopped, because his wife was pestering him. Tridge nurse sends him to the fast track area, which is basically an urgent care on steroids, built in the which is designed to handle non-emergencies and patients needing quick workups, sutures, fractures, etc. A quick exam came up with no abnormal findings and the man was given discharge paperwork by the physician assistant. As he is putting on his jacket, the PA sees some red spots on his shoulders and recognizes them as petechiae, which is basically hemorrhage occurring under the skin that can be caused by a wide variety of things. He is asked to sit back down and a full workup is ordered, including blood work. When the blood work comes back, it shows he has a high lymphocyte counts, low red blood cell count, and a platelet count of 2000. This number stands out to this day because no one in that had seen a platelet count that low. Now, a normal platelet count would be between 150,000 and 450,000 platelets per microliter, and the machine doesn't read any lower than 1000. This man was a walking time bomb. And looking back, I'm surprised he was able to get his nosebleed to stop. He was admitted to the hospital from the and after additional testing by hematology/oncology he was diagnosed with T-cell prolymphocytic leukemia, an incredibly rare and deadly form of leukemia which requires immediate treatment. Unfortunately, due to the nature of the I was unable to follow up any further on what happened to him. Not a doctor, but damn, I'm still kicking myself for it, pun intended. When I was a white belt, I was training with a friend of mine, and we were doing a sparring in our class. I was about to kick his ribs, but he just moved his knee, which colled with my foot, and made me do a whip movement. My left toe touched my friend's knee, and it hurted a lot, but I still keep the training. After my class my foot started to get bigger and bigger, but I thought it was my imagination, and walked as normal as could. Still hurted when I step on, paid for my tournament's inscription, and went to my house. When I arrived my foot looked like red/yellow tones, but still ignore it, as my mom thought it was an excuse to don't work on next day, but I still went to bed a bit earlier. On 4 AM I woke up due to the pain and I saw my foot started to have a huge hematoma and had a blackish purple on it. Me and my parents agreed to call to the hospital later. After few hours later, I went to the orthopedic and explained all what happens and showed to him my foot. I swear the dude went to a straight smile to a huge concern and said, "Okay, now this is a fracture." When he stared at my now lighter foot, me, of course, was in denial, since I paid for the tournament and all. 1 hour of recipe later, it was confirmed that the big toe had a oblique fracture in one of the phalanges. and it had more sense that my friend, the one that I had a fight with, said he heard a crack out of nowhere. .eld Kung fu fighting makes a martial artist ends in a toe injured and her ego on the ground. Not a doctor, but very recent my father had trouble breathing and was getting tired quickly. He figured it was because of his smoking and not so healthy surroundings. Pollution is high, but not China level, so my mom, they divorced, kept telling him to leave that area and come stay at our house till he gets better and finds a new house. While staying over, he still had his small bladder problem which was already known, so thought nothing of it. Because of his agent he took pills for it, so he ignored that. After a month of staying over, me and my dad went to visit my mom's brother and stayed there a while just to relax a bit, but my dad couldn't sleep because he couldn't breathe normal, and when he got up at night to piss and got back it looked like he had run a marathon. Next day I thought, let's get some fresh air, and we went for a walk, but my dad could not walk 20 meters without a 30-second break. Second night same problem, couldn't sleep but couldn't piss either. While my mom and dad talked on the phone the following morning, she demanded him to go to the hospital ASAP. The doctor said my father had a heart attack 10 days prior and got 6 bags of urine pumped out of him. His heart got pressured by his lungs which were full of liquid. It was a close one, said the doctor. Meanwhile all of this, we all kept telling him to see a doctor, just quitting smoking isn't gonna help it, but refused with jokes and stubbornness. My message to all y'allies, keep your family close and listen to them. It might be too late. If my mom and dad had bad post-marriage relationship and wouldn't keep contact, the phone call would not have happened, and it might be too late. When I was 16, I woke up one morning with terrible pain in my left flank of my back. It hurt so bad, I was doubled over and sobbing. I told my mom and we figured it was kidney stones because my father was incredibly prone to them, and that was the right spot for the pain. Multiple tests were done, and it turns out that it wasn't kidney stones. Eventually, my doctor recommended seeing a gyno, so I go to my first gyno appointment at 16 years old, not even sexually active. Find out that I actually had a softball-sized cyst on my ovary that eventually absorbed back into my body. Second thing that happened to me, I was having pretty awful chest pains when I was 20. Since I was pretty out of shape back then, I wanted to make sure I didn't have a heart problem. So, yeah, I was paranoid. Turns out I was fine. Fast forward 1 year, and I'm lying in bed one night shaking uncontrollably. The shaking finally stopped after I threw up. This went on for weeks, and through multiple doctor visits, they had no idea what was wrong. Our best guess was some random food allergy. Finally got answers from a urologist. My gallbladder almost literally stopped working. It was only functioning at 7%. Come to find out that gallbladder attacks can cause severe chest pains. I had my gallbladder removed later that year. Well, there was this one time when I was a resident at Hope Hospital in London. It was a pretty ordinary day when I was treating a man who seemed to have a curious personality disorder. During my examination I found a serious cardiac anomaly before being embarrassed by my attending. It seemed relatively harmless at the time, but later that day, while on break, things really took a strange turn. I was on the phone with my sister when a rainstorm moved in and something that felt like an earthquake hit the hospital. This does not happen in London. Surprisingly, when we had regained our footing, we found the hospital had been moved to the moon. That's when things really went wrong. Space rhinos had entered the hospital in search of a murderous alien presence. I immediately thought of the strange patient from earlier and sought him out. When I finally caught up with him, I confirmed he wasn't human and was likewise searching out the hostile alien. I don't know why, but I believed him. It took some doing and a remarkable kiss, but I was able to distract the space rhinos while he investigated. The hostile alien, a blood-suckling beast who appeared as an old woman, was eventually tracked down and captured by the space rhinos after my mysterious patient gave his lifeblood to expose her identity. Lying there dead on the floor, I started CPR on the mystery patient. After a few seconds of unresponsiveness, I recalled his anomaly from earlier. He had 2 heartbeats and adjusted my compressions to both sides of his chest. Before long his pulses returned, and he was revived. It was the start of an adventurous time in my life, and I'll never forget that patient, who ended up being a doctor himself. M. Jones, Maryland, FACCTLDR, watch Doctor Who.